And welcome to the Dr. Bob Show. Are you getting enough sleep? Do you go to bed early enough? Do you stay in bed long enough? Is the quality of the sleep you get, does that equal the amount of time? Can people sleep differently? Are there different qualities of sleep? We'll be answering those questions and trying to figure out how we can get a better night's sleep. My guest is Dr. Chris Nolte. Dr. Nolte is a fellowship-trained, board-certified sleep specialist, and he'll be answering our questions about sleep. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a leading cause of visual loss after the age of 50 and high blood pressure. Do you have hypertension and maybe don't know it? We'll be talking about those two things and how we can improve our health. A lot of information. You'll want to stay tuned. We're talking with Dr. Chris Nolte, board-certified and fellowship-trained sleep specialist. And we've got a lot of questions for him tonight. Chris, welcome to the Dr. Bob Show.
Thank you for having me. Glad to be here.
We're talking about getting a good night's sleep. Do people get a good night's sleep in the United States?
No, generally not. I think we're all chronically sleep deprived. I think we have a sense of that too. I mean, either by fun, by choice, by work, we're all sort of burning the candle on both ends.
Yeah, I didn't sleep very good last night. How often you hear that? Or I was restless, or I just didn't have time to get to bed, and I got up too early. All sorts of excuses that people have.
Yeah, I see that in and out of the sleep clinic. You see that on the street amongst friends and family too.
Does that hurt somebody's health if they're sleep deprived, if they're not getting a good night's sleep?
It does in many ways. It does just from a practical daily lifestyle functioning standpoint. So a lot of us know this. When you don't rest well, who you are, your fuse is shorter, your behavior changes, your focus and attention is off. So that has consequences for you, not only amongst your sort of social interactions, but also on the job. So accidents go up. There's been reported health adverse effects, blood pressure, cardiovascular risk, stroke risk, heart attack risk.
Obesity.
Yeah. There's a lot of really good, this is a big focus of mine here recently about sleep and weight. We used to tell people who had sleep apnea, who got that treated, that as soon as they got their apnea treated, their weight would just go down and be fantastic. But it turns out the main link is sleep deprivation. People who do not rest well, compared to people who do rest well, eat differently in the evening. How much they eat, what they choose to eat is different than people who are well rested, and that leads to pretty significant changes in weight.
Anything to do with insulin resistance? When we eat food, we use insulin to digest it in the body, into the cells. Does sleep deprivation, not getting enough sleep, does that interfere with insulin activity?
It does, yeah. So two ways. If your sleep is fragmented and just poor quality, that's one source of insulin resistance. The other is if your breathing is bad while you sleep. So some people have sleep apnea, some people shallow breathe. Those drops in the oxygen level can lead to some insulin resistance as well.
So it's a terribly important part of staying healthy is sleeping well. How do people know if they're sleeping well or not?
They often have a sense of that when they first wake. They just don't feel rested. They feel just as tired as before bed. Sometimes they wake up because their body clock is so entrenched after all those years of going to work or something. But an hour or two after they wake up, boy, they're ready to get back in bed. So that mid-late morning dip. A lot of people who don't rest well have profound troubles after lunch. So that is a normal sort of dip in our alertness for all of us. But that 1 to 4 p.m., 2 to 5 p.m. time frame for people who have a sleep issue can be quite debilitating. They just can't seem to function.
Are there things we can do when somebody has a time like 1 to 4 where they get that dip and after lunch and they feel like they need a nap or they take a nap?
Yeah, absolutely. So
is there something we can do to guide a person to better health?
Yeah, we're looking at their nighttime sleep first, just to see if there's anything there, either by their own sort of subjective experience or by external observation. So family member, something that seems to be wrong with their sleep, overly restless, their bedroom environment is poor. We see a lot of this with television in the room. All the variations in light and sound and things can wake people up without them being aware. So that's a big source of sleep quality problems.
When you see patients, do many patients have television in their bedroom?
Oh yes, a lot.
So a lot of people have that, and they'll go to sleep with the television on, or
we call these things sleep association. So little kids have their blankie, their stuffed animal.
Yeah.
The adult version of that is TV, fan on your face, this kind of thing.
Yeah, or a noise of someplace. So to get a good night's sleep, let's just go right into that. What do you tell people to get a good night's sleep?
Some things are pretty obvious. You want to optimize the environment, right? So cool, dark, quiet.
How cool? How dark?
Depends. So they did this study in patients who would wake up for no good reason and struggle to get back to sleep. That's a really common problem. Their average bedroom temperature was about 70 degrees versus people who made it from start to finish and slept very well, 60 to 65 degrees on average, quite cold.
So that'd be, now, if you get under covers, if it's 60 degrees out of here, but it's 100 degrees underneath the covers,
that's right.
Is that still 60 degrees?
Again, so that is, so that's an individual thing. So you can actually see if the room temperature is not quite right for that individual, you'll see them start to wake up, not dream as much, maybe not get quite so deep in their sleep. So a lot of it is just sort of trial and error, figure out what works for you.
There are different phases of sleep, and you just mentioned dreaming and deep sleep. Tell me about the patterns of sleep that we have during the night.
Yeah, if you take a textbook night of sleep, you'll dream about every hour and a half, 2 hours. So you fall asleep, you go through different stages of non-dream sleep. Stage 1, stage 2, stage 3. Stage 3 is the famous deep sleep. That's where a lot of our sleepwalking comes from. So little kids have a lot of deep sleep. That's where our growing hormones are released. And so they have a lot of deep sleep for all of that. Us adults who aren't growing as much, we still have some. You can have none after the age of 40, and that's entirely normal. But you sort of cycle down through those stages of non-dream sleep and back up to dreaming. And the dreaming starts off very brief, maybe 5 minutes or so. And each subsequent cycle gets a little bit longer, a little bit longer, a little bit longer. So if you chop a night of sleep into 2 bits, most of our dreaming is in the second half. And patients will say, who struggle with their sleep, that their best sleep tends to be very late, right before they wake up. And that's where all the dreaming is happening.
Yeah, and I've seen that in my house. There's an individual that says, that's the time I sleep best. It's from 5 a.m. to 7 a.m., something like that. So that fits. Are there things that we can do? You mentioned a cool room, dark room. I mentioned how dark. What makes a room light up?
Electronics is probably the biggest one, right? We have sources all over the room. So for those people who are sensitive, eye masks and earplugs or noise machines, you can really kind of spend a lot on the gear. Some other practical things, being careful about how you eat, what you do, exercise. Again,
where does exercise
super important here again. So if you do moderate intensity exercise, your body wants to respond to that by growing muscle, what have you. The way it does that is to deepen your sleep, to release those growing hormones. So people who exercise tend not to sleep quite as long, but they report better quality sleep, better daytime functioning. So they're a bit more efficient at their sleep.
So when we say exercise is important for a good night's sleep, what about how late you can exercise before you go to bed? I've always heard, don't exercise and then go to bed because your metabolism is up. But
that's right.
To me, I like to exercise before I go to bed.
So that was the teaching for the longest time. Tell people exercise early, because some people are very sensitive to the alerting effects. So if they exercise too late, they can't fall asleep. They're still wound up from that. But we don't exercise enough, and so they kind of changed those recommendations. Said, if someone's going to exercise, just let them exercise, and then we can kind of fine-tune things over time.
Is snoring a real problem in getting a good night's sleep?
It is, not only for you, but for your bed partner.
Yeah, and that's what we're going to be talking about. I've never heard myself snore, but maybe my bed partner has. A lot more information on sleep, and we'll just talk until our time is up. We're talking with Dr. Chris Nolte, board certified and fellowship trained sleep specialist. Well, we've been talking about facets of getting a good night's sleep, and how do we know if we've had a good night's sleep, and what phases of sleep are best for the body. And we start talking about snoring. Let's talk about snoring. Number one, for the person, the other bedmate that's saying you're driving me crazy with your snoring, what can you do to help stop snoring?
It depends on the person. So for many people, it's positional. So it's a very common story to hear that someone's giving you the old heave-ho, right? Just to get you off your back onto your side. So some of it is just being mindful of that person's body position. Elevating the head is helpful. Sleeping on their side is helpful. It can be a symptom of something more sinister, more severe. So we get a lot of patients coming into the sleep clinic for assessment because of those reports of snoring. It makes both people tired occasionally.
Yes.
So you can take someone who has a lot of sleep complaints, daytime functioning complaints, don't rest well, I'm tired after lunch. You put them in a new environment away, just sort of in a solo environment, their sleep is great. So it's an environmental sleep problem versus an internal one.
Wow. So the only way to find that out is trial and error in a sleep specialist in a sleep setting.
Yeah, correct.
We always tell people there are three things that cause snoring. Bad nose. If you've got a bad nose, you have to pull to breathe, and that starts the snoring. Bad throat. The throat, the back of the throat, as we get older, the muscles relax, and frequently we have flapping of the soft palate. And a bad belly, it's the same thing. In order to move the diaphragm down, you've got to pull. And when you pull, if the throat's ready, it's going to snore and going to cause problems. So you have to fix those problems. Tell me about the hazards of sleep apnea and what happens with sleep apnea.
You had sort of alluded to this before, where sleep is becoming more important in the assessment of all kinds of conditions. So patients are coming in who have just seen their primary doctors for blood pressure problems, or their blood sugar is high. They're just fatigued and don't feel good. So when we're assessing a patient's sleep apnea, that breathing, the oxygen level dropping, the sleep fragmentation that can result from not breathing well at night, links to all of those conditions, and those conditions can improve if you fix the underlying breathing problem. So a very common one is going to the bathroom at night, and you wouldn't think, well, that's not that serious, but it is a very common condition where patients will go to the bathroom 3, 4, 5 times a night and think, well, I drink too late, or this, that, or the other. We treat their sleep apnea, and that goes down to 1 or none on the very first night of treatment.
Wow, yeah. That's and what a benefit that would be. I've heard so many stories of people that have had sleep apnea, and they have the treatment, and they have a CPAP, and they wake up the next morning and they don't realize where they are because they feel so refreshed, and they feel like for the first time they've had a good night's sleep, like a windshield wiper has cleared the cloud away. You and I were talking earlier about sleep and sleep deprivation, not getting enough sleep, and how it affects the immune system. Tell me about what happens with the immune system.
Inflammation, adrenaline surges affect the immune response. They've looked at this, given circumstances of flu and other kinds of respiratory infections. When patients get vaccinated for certain viruses, if the patient is sleep deprived heading into that vaccination, their body doesn't mount the same response to that. So vaccination response is down in the setting of sleep Deprivation.
That's fascinating. You know, that the response, because we vaccinate our children and we get our yearly flu shot, and we have to get shots to prevent illness at all times of our life. And if we're not sleeping well, we may not get the protection now.
Correct.
That's scary.
Yeah.
I think, I mean, before I get my next flu shot, I'm going to see my sleep doctor.
And we're, as a general rule, we're very bad at understanding how sleep deprived we are. So that case that you gave with that sleep apnea person who just didn't realize how bad they were until they got fixed, very, very common. In medical professionals, they'll keep them up for 30 hours and say, how do you feel? Like, I think I got my second wind. Meanwhile, objective performance, their reaction time, their problem solving gets worse and worse and worse, even though they're starting to feel better.
Yeah, blood pressure can go up. The adrenal gland tries to help you stay awake and do a better job. And when that happens, it can also elevate the blood sugar, makes insulin. It really is maybe one of the most important things I frequently, when I talk about, need to exercise, sleep right, eat right, and have a lot of laughter in your life. And I try and figure which one of those four is really the most important. And the more I look into sleep quality, the more I say, well, maybe that's more important than exercise. Maybe it's more important than what we eat. But we still got to giggle and laugh.
Exactly right. Yeah, there's a big jump in heart attack with daylight savings time. When patients are getting up, they have to get that hour early. They're just not getting their normal sleep duration. There's the big surge in heart attacks with that.
That's interesting in itself. With the sleep apnea, and when the oxygen level goes down and the adrenal hormones come out, irregular heart rhythms and heart attacks are increased with that too. So,
yeah, quite a bit. Stroke as well.
And I didn't think about daylight saving time being a cause.
That's been known for a long time, and there is a sort of a body clock incidence of stroke and heart attack as a general rule. And a big peak of both of those happens in the early morning hours when you were dreaming, and it just so happens that breathing problems during sleep are at their absolute worst when we dream, because our muscles generally are at their most relaxed, including in our throat, so where sleep apnea is happening. So people will tend to have more apnea. The effects of the apnea and their oxygen will become more severe in those early morning hours.
So we've got to take care of snoring. We've got to have a cool room. We've got to have a dark room. Anything we do an hour or two before it's bedtime.
Yeah, we're not much different than like little kids. I mean, the importance of a bedtime routine is just hammered home for the new parent. But as an adult, somehow we feel like, well, we don't need that so much.
Yeah.
But it's almost sleep 101 teaching. So we try to, for those people who really struggle with their sleep, to get back to a consistent, regular routine. And part of that is just training, behavior training. And some patients, who can just pick up a book about sleep or insomnia and read this, can internalize that and do great. A lot of us need a coach, just like weight loss.
Yeah.
And so that's sort of where sleep specialists come in.
So should everybody have the opportunity of seeing a sleep doctor?
Yeah, I think if you are starting to see that the sleep issue, whatever it is that you have, is getting in the way of all of that laughter and all that, then absolutely.
And when you just look at the total body health, if you see it going bad, you need to think of underlying sleep problem. And I know the heart doctors frequently send their patients to a sleep specialist. The lung doctors send their patients to sleep doctors. People with hypertension send their patients to the sleep. So it's huge, huge importance.
Yeah, we used to try to convince the other doctors to send patients to us. Oh, this is very important and people are busy. But over the last 10 years, that has been the case. We're starting to realize with more research the links between sleep and just general health.
Chris Nolte, you're a wonderful teacher. I'm just saying, gosh, it's really everybody should be taking the opportunity of knowing if there's sleep. When you do a sleep study, can you evaluate the quality of sleep during that period of time?
We can. So it's done different ways. It depends on what ails that particular patient, but there are, the technology keeps continuing to improve, and we have way more tools at our disposal than than we ever did before.
Chris, we've got to continue the education on sleep. I hope you'll come back to the Dr. Bob Show.
I certainly will.
Phenomenal amount of information that is available for you and me to improve our health by quality of sleep. Going to want to stay tuned. We're going to be talking about the most common cause of visual loss after the age of 50. Do you know what that is? And high blood pressure, hypertension. Do you know if you've got hypertension or not? We'll talk about that. A lot of information for you. I want to thank Dr. Chris Nolte. Wonderful discussion on am I getting enough sleep and how to get better sleep. Now, questions from you, the viewer, that I think will also be very important to your health. Question number one. Dr. Bob, how do I know if I have hypertension? I thought that was a cute question. A lot of people will say, I know when my blood pressure's up because my face feels hot, or I feel tense, or I feel this way. People really can't tell when their blood pressure changes. And people cannot really tell if they have hypertension, high blood pressure. So the only way to know if you've got high blood pressure is to get your blood pressure taken. That in itself is very important, because a lot of times when people get their blood pressure taken, it's a little elevated and they say, well, it's always elevated when I come to the doctor's office. It's white coat syndrome. But that may be the only time they get their blood pressure taken. So pay attention when you're at a doctor's office and always ask, could you take my blood pressure while I'm here? What is the value? What is normal? Remember, normal is 120/80. If the 120 is too high, that's hypertension. If the 80 is too high, that's hypertension. So if we get over 140 and we get over 90, then we've got high blood pressure and we need to treat that. There are wonderful, wonderful treatments for your blood pressure. How do you know if your blood pressure treatment is working? Well, you either have to go to your doctor's office and get it taken, or, let me grab this right here, you can go to the drugstore and get a home monitoring kit. This is an Omron IntelliSense. It's a digital. And you simply put this on your arm. You have to sit down. Your feet have to be on the ground. You have to relax. Your arm should be above your heart height. And then you push the little button and it pushes the air pressure up and releases it. And it will tell you what your pulse is and what your blood pressure is. If you'll do that on a regular basis, then you'll be able to discuss that with your doctor about whether your treatment is good. Now, if you're not treating your blood pressure well enough and your blood pressure is too high, then you can have problems such as stroke, problems such as heart attacks, heart rhythm problems, atherosclerosis, hardening of the arteries to the lower blood vessels in the body. So it's very, very important to know what your blood pressure is, if you've got high blood pressure, and that if the treatment you're doing for your blood pressure is working. Question number two. Dr. Bob, what is macular degeneration? Well, it's age-related macular degeneration, so that tells you one thing. As we get older, it's something that we find commonly. After the age of 50, it's the most common cause of visual loss. Now, the macula is part of the eye. At the back part of the eye, where we call the retina, an area of the retina is called the macula that allows us to see right in front of us. So it's the central vision. It's the tunnel vision that we have in the macula. Now, the macula can begin to degenerate. There are some protein conglomerates that get in the back of the eye called drusen bodies, and that's a sign that somebody's getting macular degeneration. There's a dry type, about 85% of macular degeneration is a dry type, and then there's the wet type, maybe 15%. The wet type, you've got blood vessels behind the retina, and those blood vessels can leak and they can begin to cause damage. Your eye doctor can tell you if you've got macular degeneration and can guide you toward staying healthy with your eyes. You've only got 2 eyes. You want to take care of them, especially if you're getting blurred vision, visual problems, pain in your eyes, red eyes, any kind of eye problems. Be sure that you see your eye doctor for that. That's all the time that we have in this show. Remember those 4 things that we like to do. Number 1, exercise. Can't tell you how important exercise is. Get your tennis shoes out and go for a walk. You don't have to really be jogging. You have to start walking, and start at a slow distance or a short distance, and then get a little farther and a little farther till you're walking at least 30 minutes, brisk walk, 5 times a week. All you need to do. Now, if you want to get better results, you can increase the exercise intensity, but 30 minutes is really all you need. Remember your 7.5 hours sleep. I can't thank Chris Nolte enough for his discussions on how to get a good night's sleep, and we'll continue and have Dr. Nolte back. Eat properly. Know that the food you eat has so much to do with how your health is going to be. And what is it we like most? Is laughter in your life. Isn't it fun to be around people that smile a lot, laugh a lot, and giggle a lot, and are happy? They'll be healthier, and it'll help you be healthier also.